late 1990s, Big Pharma reassured medical professionals that their opioid pain relievers were no longer addictive and were safe to prescribe to patients. Due to this, doctors began prescribing the pain relievers to patients, which unfortunately led to the rise in the misuse of opioid pain relievers. An opioid is a drug class that includes pain medications and an illicit drug called heroin. Opioids can cause psychological and physical dependence. So a few examples of prescription pain medications include morphine, codeine, and a synthetic opioid called fentanyl. Opioid use is habit forming, especially when the opioids are not used as prescribed or when doctors overprescribe the medications. Opioid addiction can be described as the psychological need to take an opioid, increased tolerance to opioids, and withdrawal symptoms that usually occur within 24 hours without use. A few symptoms include nausea, vomiting, cold sweats, and pain, which usually lasts up to a week. Opioid use also has long-term effects, such as depression, addiction, tolerance, slowed breathing, and of course, addiction. Due to this, drug overdose has become the #1 cause of death in America. 60% of all drug overdoses are due to opioids. Overdoses are very expensive to treat. A reversal agent like naloxone is administered when a patient overdoses. It is either administered through a nasal spray given by first responders or through an IV given in the emergency department. In severe cases, patients will have to be placed on a ventilator in order to assist them in breathing and can require around-the-clock care for weeks. According to a Modern Healthcare Forum, the cost to treat an overdose is on average $92,000. The U.S. Department of Health and Human Services has its focus on 5 key points concerning opioid misuse. The 5 key points include improving access to treatment centers, promoting the use of overdose reversing drugs, strengthening and understanding the epidemic through better public health services, providing support for cutting-edge research, and advancing better practices for pain management. The National Institute of Health launched the HEAL initiative in June 2018. HEAL stands for Helping End Addiction Long Term. It is funded by Congress to research non-addictive pain management and treatment for opioid use disorders. The National Institute of Health is very confident that within the next 10 years, addiction and overdose rate will drop drastically.